Good evening, everyone. We welcome you all to our team Global. My name is Vishal, and I work as a volunteer at Adore. First, I would like to briefly introduce our organization, Adore. Adore is a global volunteer network of students and professionals motivating you towards positive action. This webinar is just one example of the impactful work that this organization does. Today, we have Mr. Chagga Jonathan, an expert on program associate and linguistics from Abuja, Nigeria. So, on behalf of Adore, I welcome you all to the Soaring Facebook webinar. We also have Pradipta sir, who is one of our admin members and is operationally in charge of Adore. Before we start, I request everyone to turn on their camera and make this session more interactive. Those who didn't register can register themselves using the link given in the chat box. Now, without further ado, let's kickstart this enlightening session. So Mr. Jonathan, you can start.
All right, thank you very much. Thank you very, very much. As he has rightly stated, my name is Jonathan Chagga. I am based in Abuja, Nigeria. And Nigeria is a great place to stay, if you ask me. It's a very, very, very great nation. And we have so much to offer. And still chances for growth in so many areas. There's the structures that still need to be fixed. And but eventually the nation is gradually developing and getting to the heights that truly deserve to be. I want to welcome everyone here. My name is Jonathan Chagga. I studied linguistics from the University of Abuja. I graduated some years back, and throughout my life journey, there's been so many issues, and especially in regards to sexual and reproductive health here where I come from. There have been challenges, there have been up and downs. I don't know if can you hear me, yeah? There have been up and downs. There have been a whole lot of trauma cases, interesting cases, and sometimes we have situations where we have cases that we cannot actually explain how it come about. So this section is just to enlighten us on what's Nigerian law saying, what is happening in Nigeria in regards to sexual, reproductive, and health rights. What's happening in Nigeria in that regard? We understand SRHR as a very crucial, very important entity for human roots and for knowledge of man in entirely. Says my body, my right, as is rightly stated always. You have right to what we want to do to our body, what we want to do for ourselves, and then how we want to live for ourselves also. We also have right to make key decisions and about everything that has to do with us. So the same way we have rights to our sexual reproduction, we have right to our health, we have rights. If you looked at the United Nations as the United Nations rights that has been listed, there are so many rights that an individual has. One of which right for reproduction and all. In some countries of the world, like my country, there's some level to some of these rights because of so many reasons. One of which is what I will try as much as possible to talk about in the next few minutes. Okay. SRHR is crucial. I will just have a slide, so I'll try to go as fast as I can. SRHR is crucial for the right of human being as a nation, as a person, as an individual, especially in Nigeria. So this section is just to give us the key areas: access to contraceptive, maternal and child health services, the importance of, I also talk about the importance of addressing gender-based violence, which is very key for the world at large, for us to have a better world. So next I talk about briefly, let me give you a view of what I want to talk about. Maternal mortality is a bit high because we cannot expect level of rape we have every day, the number of deaths per rape and all. So we have estimately about 10,000 lives per year, per month rather. So all the time we have new children, we have new children coming up. We have cases where most of these kids are either by rape, by so many means of which they can come. And then the adolescent pregnancy is a bit high also where I come from. Adolescent pregnancy is a bit high because we have a whole lot of issues. I have cases where teenage pregnancy happens, secondary school or high school students, rather we are pregnant, and then the law in Nigeria does not give you the flexibility to just go to a nearby clinic and either choose to whether you want to keep the baby or not. Even for case of where the mother's health is actually a problem, they don't also give you that flexibility also. We also talk about the availability of contraceptive. The contraceptive availability is actually very low, and you can only have like 12% for married women. What about the young adults, the teenagers that got pregnant, either not by their own doing, probably cases of rape or cases of just those things they do for fun, and then they don't know how it happens, and then it became a baby. But what will happen to such? They don't actually give them medical access or contraceptive in Nigeria. It's very, very difficult. Now let's talk. Let me say briefly the legal framework. What's the law saying? In Nigeria, there are several policies and laws that are put in place by National Production Health Policy, and this are for the sake of gender equality and others. So there's also bill being passed presently by this house. There should be cases where, as I mentioned earlier, I said nature they don't allow contraceptive for especially single on not ladies that are not married, even having access to having medical attention to some level, they start asking questions. Where's span? How do you get pregnant and stuff like that? No, but they don't understand the fact that it's their body, so they decide what to do with it or what not to do with it also. But there are gaps in implementing most of the policies. That's what I'm trying to say. There are a lot of gaps in implementing most of the policies how to enforce these policies. This has hindered a lot of the SRHR development in my nation, my country. There have been efforts, the ongoing effort by the government, and there are a lot of civil society, civil organizations that are finding a way to either protest, talk about these things, do policy, talk about making policies that will work, go on sensitization, go to the communities, go to the cities, the rural and the urban areas to try and explain why these policies must be put in place for the sake of sick mothers, rape cases, especially when the lady is being raped, medical reasons that the mother cannot give birth because of. There should be consideration of all this and more when it comes to childbearing. Okay. That's where we are legally. Some part of the country, there have been some level of partial cases where they say, okay, for this reason, they should allow this. While other part of the country, they don't even mention it at all. And then even some countries where these policies have even been accepted to some level, there's still some issues that I'll talk about, like stigmatization and all. They still have a whole lot of it in some of these countries. Most of these countries, not even some, most of the countries around the world. Okay. All right. Next, I'm trying to just go through the slide as I talk, as I try to explain. Are you with me? Okay, access to contraceptive in the country. I've mentioned earlier, contraceptive is not easily accessible. You cannot just walk into a clinic and then say, I want to get this, and they are available waiting for you, or go to a hospital and say you want this and they are available for you. It's usually okay. Thank you very much. Thank you. I think I'm page 4. So now it's usually very difficult to have access. Thank you. Very difficult to have access to this contraceptive. Now, if you go to a clinic in Nigeria, as even a married woman, and then you say you don't want to keep this baby, you want contraceptive, they ask a lot of questions. They don't even, the law does not even permit a doctor to just give you these things. They may have to do some interviews to understand a whole lot before they release this contraceptive for you as a person. Okay, the quality of this, because of this, because of the these things, because these things have not been released easily, you can't get access to this contraceptive easily. Need to, where we have a lot of quacks, a whole lot of quacks thinking, trying to do this for, and then it leads to loss of life for a lot of women, and then probably loss of some of these ladies, because after this they could not actually, they cannot actually have child again because their womb has either been tampered with or otherwise. So because if the policy, if at all, there will be a time where there will be proper policy to help solve most of these challenges. We will now have what we refer to as professionals. The professional doctors will take it up, and then there will be proper law to guide how this is given, who is given to. But because there's no policy guiding, there's no law that accepts contraceptives in this part in Nigeria per se fully. This actually means there are a lot of illegal way to get this contraceptive. People will just go where they want to and do how they want. But when it comes, there is availability of family planning drugs for married women, especially. So you can, as a married woman, you can go to the hospital and then tell them you want family planning with your husband. They will give you any clinic you can just walk into. But aside that, you cannot, when you are pregnant, you don't want to keep the baby. The idea of your body, your choice can never come into place. They never consider those things. Hardly, even if a doctor is trying to do that, help you do that, they will have to look for a way that will not implicate him, because there have been cases where license has been revoked because of doctor prescribing drugs for prescribing drugs for a lady to have an abortion. There have been cases where doctor license have been withdrawn because the law does not permit it. There are cases where it leads to imprisonment when anybody try to do it. So that's why there are a lot of parts that will do these things behind. They'll just tell you where to meet them somewhere. They will direct you to a clinic that is far from town. They will take you to places where they know they can easily do these things and go without any without no security persons catching up with them. They think of all these things. Accessibility of these are very, very scarce. This, you cannot easily go to the clinic and get these drugs, as I've mentioned earlier, because of course there are policies that does not make contraceptive easily available. There are a wide range of contraceptive options, but accessibility, and they are affordable to some level, but they are not really, really available. And most persons does not even know what they are supposed to take forward. So there are cases where people believe that the only way to do this is go through a CS section, a doctor go have to do a DS, a DS, where they go have to do like an operation for you before they get these things done. But they are on drugs, especially for early pregnancy, 2 months, 3 months. You can easily do that with ease, and then you don't need all the stress in those access. Okay. Now, because of strictness for the law in the land, they became a lot of challenges. Now, I've not explained, let me try to say this now, because some cases where it has been reported that ladies use funny things for this purpose, they make use of scissors by themselves. Now, a young lady being pregnant by herself, decide by herself she will want to abort this baby, and then what she use by herself, no medical personnel there, no one assisting her, nobody, by herself, because of the fear of stigmatization, because of the fear of what my parents say, people around the society say if I eventually I have this baby. So they tend to look for a way around it by themselves. Now, some of them rely on their friends. Some of them will rely on their own self. They want to do these things by themselves. So it leads to a lot of bleeding and death. Cases where some lady took some chemicals that normally you're not supposed to even allow ingest these chemicals to your system. But they took these chemicals, and then what happened to them at the end of the day? It leads to they are dead. They bleed uncontrollable for a long time and eventually lost their life. Not just the baby, now they lost their life also. It's terrible when you see those cases. It's terrible when you look at those clips and then see what people are actually going through. Especially if you're in the street and then you're asking questions and they tell that this is what has been happening, because accessibility is a bit difficult. You cannot just walk in, you have to go behind the counter. They don't sell it for you, they don't sell those drugs for you on the counter. You have to go behind the counter. Lack of proper information and all has been a very, very serious issue. Okay, maternal and child health services. That should be the next slide. If you are with me. Maternal and child health services. Okay, thank you. Mental antenatal care. So to ensure this is just to ensure. Yeah, thank you. Thank you. This right. This just ensure that all pregnant women get regular check. This is very, very much available in Nigeria, as in every clinic every hospital has a section where they take your antenatal always stay up taking place. So this is very serious. They make you go for regular checkup, especially as a pregnant woman. Though the major challenge now is single ladies most times have limited access to these facilities, because when you go even if they give you access, they keep asking questions: where is the husband? Who is the father of the child? Where is the father? Where is the husband? And all. And as a single lady, you don't have this. Probably either you don't want to continue with the man, or you don't have access to some of these facilities, things they're asking you for. It becomes really, really difficult to actually get this antenatal care from these hospitals. Safe bed, because most of the women have said married women have access to, and if you don't have this access, but because of that, those people that doesn't have access, we always find it difficult to have child safely. But for those people with access, I can continue. Yes. Thank you. They have professionals all over the hospitals that can assess giving birth when you want to without any difficulty. Though the challenge is most times is people in rural communities. Some communities are a bit far from town, but in every clinic, in every hospital, there are always professionals for help you for antenatal. There are always professionals to help you for the postnatal also. Postnatal care is also very strong. The strengthening services is excellent care to monitor health and well-being of both the mother and the newborn. It's actually very, very, very strong. Even in the cases where they need an obstetrician, in case of emergency, they have all those services available in every hospital. This has actually helped in reducing neonatal mortality. That's losing the baby at birth. This because of the antenatal care that's made available, and then the good services, skilled professionals for the childbirth, and then it helps reduce the level of death for a child at birth or even during pregnancy. These skills are very, very actively available by most Nigerian doctors. Nigerian doctors and Nigerian nurses and midwives, especially, they are actually skilled in giving birth. I don't think there's any issue that's so demanding when it comes to childbirth in a country like Nigeria, because they have all the facilities in place that can help achieve that. Okay. So okay, as I said earlier, I will try as much as possible to talk about gender-based violence. It's something that we cannot do without. Can I have the next slide, please? Okay, gender-based violence. There's a law. Can I have the next slide, please? Thank you. In Nigeria, there are laws and regulations that are serious to him to understand what he thinks than getting an older person. Most times they don't want to talk, they want to keep it to themselves, especially the adolescent, young teenagers, they want to keep it to themselves, especially if they see a young older person. But a younger person like themselves, someone they feel relating is relatable, someone they feel can relate to all their needs, they can easily speak out to that person, they can easily tell that person what they want to say, they can easily explain their basic challenges to that person than when talking to an individual that they feel might not actually understand what they are saying. Okay. The last slide, we're talking of most of the challenges and possibly recommendations. The challenges and possibly recommendations. One of the challenges is limited access to SRHR services in rural areas. I tried to explain that earlier, as most of the services are not available. What to be done? What's the recommendation? What am I recommending? I'm recommending how to strengthen community-based services, to strengthen community-based services and deliver more outreach programs that will go to those communities. Now, if you have these services available, do outreach program, go out to these communities. We've been talking, discussing online, discussing in city urban areas, having meetings among others that actually have knowledge already. We should go back to these rural areas where we meet them at the point of their need, down where they are. And that's where we're able to explain the various services and let them understand the kind of access they can have, what they to do. They should understand their body is their rights. They should understand, have basic sex education knowledge, know that they can use protection instead of thinking of taking lives at the end of the day because of unsafe abortion. Okay, next is we'll talk about persistent social cultural norms and stigma around the SRHR. There are a whole lot of social cultural norms and stigma around SRHR. What's this? Because there's a traditional way of doing things. I've mentioned earlier, we should understand that what happened 15 years ago is not what is happening now. There have been more innovations, better solutions, better ways to solve these major problems. So we should not think that how it happens 15 years ago is how it's still happening. So we should try as much as possible to forget some of these norms and then think of the way out, more advanced method to solve the problem. We should engage with community leaders, we talk to religious groups to promote social and behavioral change. A lot's been wrong, a lot has been going on wrongly, a stigma especially. If you, for instance, if you are a single lady with a child, there's stigma. If you are a single lady that was pregnant and then could not keep baby because she feels she can't keep the baby, there's this stigma when the society finds her. So we should talk about these things with society so that we should reduce stigma as much as possible. Even in the country, even if the advanced country, they still stigma to some level. There's a lot of stigmas going on. So it's not that these ladies, for instance, that do abortion, they want to. They don't have plenty choice. They don't have a lot of options. They are desperate at the point, and then sometimes they are too young to have baby. That's why they decide to do that decision. Or sometimes it's not age, it's finances. They don't have resources to take care of that baby. So why have a baby where you know you cannot actually provide all its basic or all our basic needs? So they find a way to solve this issue but stigmatization will not actually allow these things to flow for these young ladies or this young person. Insufficient funding and resources for SRHR programs. Now, because the law in the nation has actually made this legal 100%, there are a lot of limited resources. There are a lot of limited resources, donors who help fund organizations or SRHR projects are very scarce. Persons to resources that will help talk to people, make them understand, to help solve stigma problem, to give basic sex education to teenagers and young adolescents, especially teenagers, adolescents, and young adults also. They don't have insufficient knowledge. Now, there's not enough resources, there's not enough funds to go to, especially rural areas, to talk about these things. So what my recommendation is, we should increase We should have increased government and donors investment in SRHR to ensure sustainability and equitable service provision. If enough resources are available, there will be a better service provision. We have to go deep down into the communities, into the rural areas to talk about these things because resources are available. We empower those that we can empower. Also, they can empower more persons to still go to the field to talk about these things. As you talk, we empower. You talk, train some set of people. You empower them to go back to the community. You train another set, you empower them to go to the communities. Now, if resources is available the way it ought to be. All right, next, there is weak monitor and evaluation system. We should establish the system is weak. There's a lot of weak monitoring. There's a lot of the evaluation has been poor for the system, especially. What am I saying we should do here? We should establish a robust data collection and analysis mechanism to ensure evidence-based policy and program implementation. Now, as I've said before, there are limited funds available, financial resources available for this project to be carried out. But there are also persons that get funds for this project, but they have not actually, there's not efficient evidence to show that they have done this. It's not sufficient evidence to show that this has been done. The resources are just been there, individuals are keeping it to themselves, or the projects, what these resources come from, have not actually been achieved. Now, it breeds a lot of scarcity and improper knowledge. Now, those persons that have been donating all this while have been supporting to see that this SRHR has gone to the grassroots the way it ought to be. Might not want to give because they're not be getting evidence for the previous resources that they have released. If there are enough evidence to show that this project has been carried out, this has been done, this is what we need to do next, we now have easier solution to it because everybody will have good knowledge, and with the good knowledge, we're able to implement more projects and go to different communities. More people will be reached, and better solutions will come up. Especially when it comes to domestic violence, some communities still have a lot of cases of domestic violence that's actually not nice at all. All right. I think that's all for the slide. That should be the last slide. Yes. I want to give room for questions. If you have questions, you can raise your hands, ask your question. Try, if you can type in the questions also. I'll be able to read them and then provide answers as soon as I can. Okay. All right, I've seen one question. Can you explain the current state of sexual and reproductive rights, health rights in Nigeria? And all those rights are HR rights in Nigeria. I think I try to explain the okay, let me go back to legal framework. In Nigerians, there are policies and there are laws. There are policies and laws guiding the SRHR. And those policies in the country have not actually been, it's not positive for a common, that's why I said it's for a young lady to get pregnant, and then it's a big deal. It's a big deal. They don't understand my body, my rights. Most times we talk about these things only if it's them, their family member, or someone that is close to them. They don't even say it loud. The current state of this law in Nigeria is, the thing is, the law has not been implemented. They're still debating in the House on whether it should be approved or not. They feel because of cultural reasons, because of religion reasons, and then because of cultural, religion, and other reasons, stigmatization, nobody's really talking about it openly. They only talk about these things behind the scene more like. And then a state in Nigeria recently, a state in Western Nigeria recently adopted a law that permits this for pregnancy, for instance. When it comes to abortion, they permit some cases that this can be done. In some cases, not in all cases. In one or two states, one state in Nigeria, that's the only place that you can actually confidently enter. How does this right compare to international standard? International standard, for the advanced countries, they have policies that has actually seen this law as active currently, and they are working greatly with them. In Nigeria, it's not like that. It's practically almost the opposite, except probably for married people. I've explained how a single lady cannot just walk into the clinic and say she wants to take family planning drugs. The next question might be, where is your husband? How will you just walk in and ask for family planning drugs just like that? You have to be married, come with your husband, or probably come with evidence that you are married or stuff like and things like that. You cannot just walk in, and then they ask questions a lot. So because of that, it's been really difficult making headways in Nigeria and some of these laws to making headways. Now the first thing first, where we are presently is trying to see how much of this law will be implemented. The legislator in Nigeria and those persons in charge of making these laws have been debating over time, over a long period of time, on how to solve this, how to make this, at least they should have some level of freedom, they should have some level of opening so that persons can actually go to the hospital to get this. If you're not married, it's difficult. If you're a single lady, even normal sex education, you cannot go to some schools, public schools, to talk about these things now. They say, no, you cannot tell these things to our students. They have a structure of what you need to sell them and what you should not tell the students. They assume you are trying to either make these laws difficult for a common Nigerian. The next question is, what are the primary challenges faced by individuals in Nigeria accessing sexual and reproductive? Stigmatization is one of the common challenges. Unavailable, the drugs are not really available for want to do abortion. The drugs you cannot just walk into a clinic or a health center and say you want these drugs for this purpose. As a medical doctor, they do not even want to see you advising a patient go do abortion openly. You have to look for how to, first of all, prevent yourself. I said earlier that there are cases where medical doctor's license have been revoked because of the either directly or indirectly participated or advised someone to go and do abortion indirectly. It leads to a license being revoked, even if it's a case of rape, even if it was a case of health for the lady, woman especially. They don't take those things and then see them as reasons enough. We say, okay, you cannot keep this baby because of your health. You cannot do this because of your health. You can't. They don't see them as reason enough at all. They want it to be that as long as you get pregnant, it's God's will. You give birth to the baby will come. Whether your health can carry it, they don't most times consider it. They only want to start considering when it's time to give birth. They say, she cannot do, and then they start looking for ways around it. The law does not permit for other ways. There are a lot of challenges faced by those individuals. Also, when it comes to domestic violence, I tried to mention earlier that there are cases of domestic violence that you will report, and then they'll be like, it's family thing, the family will settle themselves. There are cases of rape where you report. The next question, the policeman or the security agency will be asking you, the ladies, how did she go to the house? Where did it happen? They say it's in a guy's house. You say, what did she do in the house? What was she wearing? Even if it's in the street, the next question they'll ask, what was she wearing? And then now they try as much as possible to paint the victim as the bad one, not the of those persons committing these crimes. Though in cases where it's been proven that this thing actually happened, they have been sentenced to prison or fine at worst. That's the best thing that can happen. They cannot actually say because of this thing that happened, they will either the worst that can happen is probably sentence you to 3 years, 4, 5 years in prison if it's severe, or that's basically all they always do. Also, terms, there's been discussion to make access availability for better sexual and reproductive health services. There's been discussion for openings and to see how this will be easier and better for the victims and nation at large. All right, I also hope I've answered the two questions. Have I? Okay, I just see your other question now. How do you address issue? Yeah, I just got the other question now. Issues of sexual recent. The major case has been the case of the rape of a staff in one company in Nigeria where the manager raped her. What has been done? The case is still on. Most times rape cases have usually take long. This is one example I'm giving. The case is still on. The only thing they did to the manager for now is he's still free, have not been in prison, but they suspend him from work. A very big brand company in Nigeria, they cannot mention it for some reason, for how everything happens, how he took her, they drugged her, took her to the hotel, did what he has to do with her, and then left her there. When she woke up, she noticed she was in a place that is strange. She went to meet the receptionist. How did she get there? They after to and fro, they show her CCTV camera on how she came in. That's how she got to know that this was the person that brought her here. And then after like 2 hours, he left, leaving her there. So the worst that has happened so far is this man has been fired, as been said, and that's all that we've known so far. The case is still in prison. This is like third month going. The case is still in law, in court. They're still going to and fro because one has resources better than the lady. They have to take the case is even still on because there are a lot of civil society, there are a lot of NGOs that have interest in the case. That's why probably the case is still on. Otherwise, in Nigeria, most times sometimes it's the person with the biggest back, that is the highest money, that always win the case. But because there are a lot of interest all over, it makes it more interesting, and a lot of persons want to see the outcome. They want to know what's happening. They don't mind donating. They don't mind contributing to see that justice has been served. They don't mind to see that this person is actually punished for this crime, because probably it has been doing it with others and it is going away with it. But this lady come up to report, speak out. She spoke out. That's been one of the things that is helping the case to still push up to now. Another thing is, I understand that for stigmatization's sake, most people don't want to talk about what happened to them. They don't want to tell anybody. They feel it's better they keep it to themselves than report it out, because they don't know what will happen if they report. How will it haunt them? How will it feel for them if they report that this is what has happened to them? So they tend to want to keep it to themselves and then not say it. But this lady I'm talking about now, have someone courage to report, and then the case is still in court presently. We just hope it has positive outcome. It should not end up like every normal Nigerian case that most of them that always happen, that we just end up saying that the man is innocent, was consented, as he have mentioned before, that the lady actually agreed to it. But the lady is saying she doesn't even know how she got to the place in the first place. So it's the beginning of they went for a party, the next thing she knows she was intoxicated, and then he took her home. In his mind, he wanted to take her home. He doesn't even know where she's staying. And they ended up her room where she was. But that's what it is. That's how it is for now. So there are so many cases like that. Some cases you have this, the government are trying all they could, all they can, everything with all their strength to see that every penetrator, everyone that's involved is punished. In every case, is not just this one. They're trying all their available best to see that antenatal services are always available in all major or almost every medical centers in the country. They try as much as possible to see that health services are available, and then make it a law that we punish anybody, anybody that if any rapist, make it a law that laws for punishment, there are years imprisonment, and then there's debate to increase the length of the punishment. It's 5 years maximum now. And then there are debate to see how they can increase it from 5 years to maybe 10 years. And then if that is done, 10 years with a file that's reasonable, maybe 10 million naira, that is equivalent to $10,000. 10 years or a file equivalent to $10,000, but to help prevent or reduce the number of rape cases that has been coming up. So for some time now, apart from this major one, there have not been so much when it comes to rape. There's not been so much when it comes to reporting of rapes and all. But when it comes to area of abortion and all, the Nigerian law does not permit at all. That's why I've tried to explain that contraceptive becomes difficult. There are a lot of quacks because the law does not permit, and people will have to do this, so they look for a way to go about it. And they have to go to a place that is not in town, place they'll just take them to somewhere, one small building somewhere, and then the doctor is just there and then do that, collects money, and then it moves on. There have not been so much law on how to implement and make this a law. If this is a law, for instance, even if it's not 100%, some level, have some percent, okay, for this case, this is what will happen. For a case of rape, the lady can go ahead. For a case of, for medical reasons, it can go ahead, but Nigerian law does not even permit, even if it's medical reason. But the government through the legislature are doing all they could to pass laws that will make sure that there's punishment, and the punishment is serious one, so that victims and persons that are involved, we know that this is wrong, and this we do to save victims also. Thank you. Okay. Individuals can contribute. Individuals and communities alike can do a whole lot to promote sexual and reproductive health rights in Nigeria. Individuals can go for outreaches. As I've mentioned, there are a lot of outreaches going on, and there's still more that can still be done. As an individual, you can talk to your next door neighbor because you have better knowledge. You can explain to the person next to you because you have better understanding on what this is. As an individual, you can post on social media handle, do promotions, and then talk to people in your space about how to protect and to advance as sexual, to have better knowledge of what sexual and reproductive health rights is. As a community, with the knowledge gotten from individuals are what makes communities. If there's an outreach, for instance, that went to a community for an outreach, explaining these things to them and making them to have this understanding practically, making them to see, relating these things to things that happen around them. Is it the violence, domestic violence? Is it the teenage sex that's all over? Is it the case of teenage pregnancy, adolescent pregnancy, young adults getting pregnant? Is it the case of rape, domestic violence, and the likes of it? Make them understand these things as relatable as possible. Make them see that this is what is happening in their society and their environment, and then they will see reasons why we should start talking to teenagers, young adults, adolescents on how to live better, how to have more protective sex, how to see how to even stay without abstinence from sex as a way to solve the problem. So that's how I think best we can reach out to communities and make them have more knowledge on in the advancement of sexual and reproductive rights here in Nigeria. Okay, if I had the opportunity to change or implement new policy related to sexual and reproductive, which specific policy will you introduce or modify? Additionally, whom will you focus on educating? And what key topic will you emphasize in the educational effort? Okay, if I have opportunity for one law for abortion, for example, I want us to have a law that there should be an exception. We've tried a whole lot to say sexual abstinence is the best. Most people are not even listening to you when you say these things anymore. So I think if there's a law, now the law, no lady, I can say it anyway, no lady will be happy to go behind the scissors or do abortion. sometimes the trauma is still there for them over there. So somebody will not be smiling all the time and say, I'll just do this thing and then have this can easily be solved. No, because of the trauma, it's not what they actually want at any point in time of their life. Not even the guy, not the lady. So if I have my way, there'll be policy that we make this accessible easily so that we reduce the rate of quacks. Reduce the rate of quacks. Those they are not professionals because they know it's one or two things and then they want to administer. There should be people professionally trained to make this service, make this service when it comes to abortion, for example. People professionally trained for that. That way to reduce quacks and then help save the life of the mother and also of the child so that the future there will not be where this woman cannot give birth again because of the previous abortion she done, provided because of the person doing it was a quack somewhere that's not a professional. But if the law permits it and then train these people to be professional, for young pregnancy exemption for that. Okay, what policy will you introduce or modify? Okay, this educate, which I focus on? Okay, I'll focus on educating. Can I say the ladies? Most times the ladies does not know their rights. They don't know what they ought to do. The female now, they don't know most of their rights. They don't know what they need to do. They don't know what they don't need to do. They just assume it's a man's word. So because it's a man's word, the man runs the world. So I will have bigger opportunity. My major emphasis with educating more ladies, more women to know that they have the right also. They have knowledge, they have things they can do for themselves. They should not depend on one man. Because most times where the domestic violence is always there is because the lady cannot do anything. She cannot defend herself. She cannot speak out. Why can't she speak out? Because she doesn't have resources. But if she's empowered with resources, she has a business, she has what she can do to make money for herself, she will be able to defend herself with ease. She'll be able to speak out for herself. She'll be able to step out when the violence is taking place. She'll be able to leave that environment or leave that marriage, if that's what it means, for her own, for the sake of her mental health, for the sake of her well-being, for the sake of her future. So I will focus on emphasizing, my more emphasis in educating young ladies, teenage ladies, probably teenage youth also, for them to have knowledge that it's not part of their right to beat a lady, for instance. It's not their right to pregnant a lady and leave her. You should understand this as not a right. And then once these ladies have knowledge, I'm sure if these ladies have better knowledge, they'll be able to deal with situations better and easier. Okay, I hope I've answered your question.
If there are no further questions, we will conclude this session. Thank you, Mr. Chagga Jonathan Taro, for hosting this insightful webinar on sexual reproductive and health rights in Nigeria. Your presentation was both informative and engaging. We extend our sincere gratitude to all the participants for joining us today. ADOR is a non-profit organization that offers unpaid internship and volunteer opportunities. Individuals can utilize their time and expertise to support ADOR mission and various programs, thereby serving the community and making a difference. For more information and to apply, it is recommended to contact ADOR directly or visit their official website. We have provided feedback link in the chat box. Please provide feedback using registered mobile number. Thank you once again for your participation and contributions in today's session. We eagerly anticipate seeing you at future events.
Thank you very much for having me. Yes, thank you.